You everyone very much for joining us again. Welcome back to Inside ISAPN. I am your host, at least for this year, Chris Gill. I am the president of ISAPN. And today we want to talk about how APRNs are expanding their influence beyond the clinical realm, so beyond clinical practice. And we all know that this happens through a variety of means: leadership, advocacy, policy engagement. But really, ultimately, we need to have a unified voice across Illinois and why it's so important. And today I'm joined by my co-host for the episode, Rozina Virani. So, Rozina, I'd like to welcome you to the podcast and thanks for joining us.
Thank you so much, Chris. I'm really excited to be here. This is such an important conversation for our profession, especially right now.
Yes, absolutely. There's so much going on. There kind of always is. And both of us being on the board for ISAPN, it's even more
Yes.
important that we share with individuals, what it is we believe in, why we're doing what we're doing, and to try to get them involved. So, with that, I have a couple of questions for you, and we can go off script. It's totally fine. But I'd like to start with the big picture, and I'd really like to know what you feel it means for APRNs to expand their influence beyond just direct clinical practice.
I think that's a great question, Chris, because for many APRNs, our identity starts with patient care, and that's where it should start. But expanding your influence means recognizing that your expertise does not stop at the bedside, it extends beyond the bedside, like how care is delivered, how systems are designed, and how policies are shaped. So it's about moving from individual patient impact to population and system level impact. That might look like leadership roles, policy engagement, mentoring, or even just being more visible and vocal about the value of APRNs bring to healthcare.
I love that, and I really appreciate the response. And I want to just, dig in just a little bit deeper there because I think, you said it. We all start as clinicians. That's really kind of what the initial licensure path is to become a registered nurse and then
Yes.
subsequently an APRN in one of the four disciplines. But so often we're challenged to kind of look outside that direct licensee role.
Right.
Just curious if you could share in a short form what it was that was your aha moment for moving from just and just is not the right word because we say that and it almost makes people that are in clinical roles, 100% clinical roles, feel bad. But what was it that really the aha moment for you to go, okay, I want to do other things outside being a NP in the clinical setting only? What was the moment for you?
Chris, I must tell you that when I was studying at North Park University and getting my family nurse practitioner, master's done, and then I remember our first ISAPN. I think she was the chair. I can't remember at that time. She was a chair of the Northeast region, or she was actually the president, I think. And then she came and gave us a talk, and she told us all about what a wonderful. Um, um, things ISAPN is doing for our fellow nurses and fellow
Mhm.
nurse practitioner students. And at that time, I started joining some of the meetings as a student. But then I took a little break because I got busy with the new job and I was a novice NPN. And of course, the work hours and work life balance was a
Mhm.
little bit harder. But then I always stayed connected with these leaders who were actually championing and paving the path at that time for us. And then I always look upon them and say, man, I want to be part of them. This is where I need to go. And then when you start working, there's so many challenges coming, policy wise, guidelines wise. Sometimes you just have ethical issues to discuss. So I couldn't find the better platform than ISAPN to verbalize. And then in the meanwhile, April Odom became my mentor. And then she started moving me into some of the meetings and conferences. And I took that opportunity like, oh, this is for me. And then we clicked, and from there, it's not going back or turning back. Learned so much, Chris. I must tell you that I've learned so much about the advocacy. I learned so much about our presence, our as an
Hmm.
APRN presence.
Hmm.
So your aha moment, yeah, would be different than my aha moment. But my aha moment started when I was a nurse, a student nurse
Hmm.
practitioner, but I was a nurse at the same time. So it was great to find a mentor who can, literally handhold you and take you through those pathways. And then I started joining the ISAP, and I started attending the meetings regularly. And then I found different meetings and committees where I started joining to learn more and more about it.
I love it. And I think that story is going to resonate with a lot of our listeners
Yes,
because so many people have been there, and there's a variety of ways that that first kind of feeling starts to grow in us, I think, to do more than going to the hospital or going to the clinic and earning a paycheck for the services. Not that that isn't incredibly rewarding, but to expand one's abilities beyond the direct patient care role and start showing, the word I would use is value, the value outside those clinical realms,
yes,
the visibility. And so I totally appreciate that. And so I hope that individuals listening that are in similar spots right now to where you were many years ago will really hear that and say, okay, if I can't do it today, I need to do it tomorrow, right?
correct.
These are the paths to take. So
It's always keeping back in the mind. And let me add I felt like somebody is listening to me.
that's
That's a
good.
great blessing. That's a great
Yeah.
blessing that you're talking to somebody who is at the same page and listening to you and taking you to the advocacy route. So I think
Hmm.
that's a big thing. And ISAPN is all about it.
Yeah. And that's a reminder, I think, for them. I had the opportunity to serve on a panel for a different
Hmm.
organization. It was talking about next gen leadership, and the kind of request was to speak to those that are growing into leadership roles and those that are about to leave and what they can do to kind of bridge the divide. And I think what you just said there really does resonate and should resonate with those that are either have done or are leaving the roles. It's
Yes,
really paving the way for the future and the impact they can make. So that's great.
agree.
All right, let's kind of talk a little bit more about the transition. So, what does the transition between clinician to leader look like for you? How did that happen? How does that work in your mind?
So, Chris, for me, I started looking for the answers, and I couldn't find sometimes answers in the books or in my with my manager or with my coworkers. And then I found that ISAPN is a great platform, which is giving me lots of answers, policy wise, advocacy wise. Um, and I can verbalize what shortcomings are there, what are some of the challenges are there. So what I did is I started attending a lot of dinner meetings happening around me. So I went there, and then slowly I enrolled myself into the committee member. I became a committee member first, which talks about how we can increase our numbers and admission committee. And then I loved it that people were listening to my conversation. They were taking me seriously and taking the suggestions seriously to how to expand this role. So I really started. After that, I joined the GRPAC committee,
Hmm.
and that is the committee which took me, like, she gave me the lift off. And then I started working on the advocacy part. I met my senator. I met my legislatures, and we were able to talk to them one on one, send them the letters, talk to them, verbalize our points. And I needed that platform, and
Hmm.
actually the platform was already ready, which I didn't
Hmm.
knew. So IACPN introduced to me, and that's how I navigated it. And someone here handholded me. I mean, the presidents are the great inspiration for us, like you, Dr. April, the Stephanie was there, and they all led me to one by one and step by step because it doesn't happen overnight. We have to
No.
learn the process, and it helped me learn. And then I started engaging in them. I started developing the interest in it. Even though I had busy schedule, I made sure that I attended all the meetings because going to the meeting and learning from each other, it's the only way we will connect with each other. So baby steps, I got in and then I started getting involved myself into these programs, into these meetings, into these, and then I went to the Capitol myself and saw it and personally witnessed it. And it moved me. It totally moved me. And now that I'm serving as a region chair, it's a big responsibility. And now people are looking up to me and saying, how do
Hmm.
I do that? Or where do I go from here? So baby steps, but getting involved fully is the answer. So I feel great after getting involved. Great
I
question,
love
Chris.
that. I love that. And to your point, I mean, it's small incremental moves. It's rarely a big sweeping change. And what you said about the meeting with lawmakers, legislators, resonated with me because for a number of years, having gone to DC with the American Association of Nurse
Yes.
Anesthetists and lobbying for CRNA centric issues before I became an MP, you get in there, you feel like you got to run through a laundry list of things that the organization has given you, and you feel a little not dismissed, but you feel like people are a little confused as to what it is you're talking about because they don't know the issues per se, right? They're not healthcare practitioners. They're relying on you to be a subject matter expert. And I think um, I'm betting you're going to agree with me on this, but the power of storytelling, of talking about a patient you cared for, a situation you were in, to your point, a policy that was constrained the ability to do something that was in the patient's best interest, those things are meaningful, right? So bringing that lived experience, I feel like, is the aspect of direct patient care we all need to tap into to bring it home for lawmakers. And it sounds like you've been very successful in doing that.
Now, I'm blessed to find great mentors around me. And I think this organization gives us, it opens the arm. I always tell them, come, sit with me, talk to me. Let's go through the mission and vision of ISAPN, which tells us the whole story about it. It tells us how much we have been advocating about our APRNs. So leadership isn't optional. I tell, we all are leaders in ourselves. It's not optional. It is essential if we want healthcare system to truly reflect the needs of the patients and the provider, we need to be in this role and in these shoes.
Love it. Okay. From your perspective, my next question really drives at, and we've talked about it, but I want to get a little bit more specific based on your perspective. Why is it so important for APRNs to step into leadership and outside of the direct patient care role?
It's very simple, Chris. Because if you're not on the table, still there are people on the table and making decisions on behalf of you. So
Hmm.
I would rather be at the table listening and being part of it. So when they are making decisions related to the healthcare system, related to the patient care, related to the advocacy guidelines, related to anything which is directly and indirectly affecting us, APRNs need to be there on the table. They bring a holistic, patient centered lens so they can impart their knowledge with them, the people who don't know, because we are the stakeholders with them, right? We are sitting there, we are telling them what we are facing, what are our challenges, what would be right way of doing it. So they hear, they listen to us, and it's a combination of work. So it's a
Hmm.
collaboration happens when you yourself as an APRN sitting on the table talking to them and bringing all those issues while they are forming the policies, and you want those policies to be in your favor, not
Hmm.
in other people's favor. So I think sitting on the table together and bringing those policy, working on the policies together, helps our system and helps to avoid the burnout in APRNs.
Oh, I 100% agree with the burnout piece. And I think that's only gotten so much more airtime as of late. I mean, two things, and they're slightly hot button topics, and I don't want to go into them too deep, but it's that burnout and I think DEI. And, burnout. it was always like just be tough, just deal with it, right? And you'll get through it. We've been through it, you'll get through it. And I feel like that is such a, you know, very, very narrow view to take on the issue, right? We have to really dig into understanding why our colleagues are feeling out of place. Is it the system? Is it stressors at home? There's so many, the human condition is so multifactorial. And then the DEI thing, whatever it's called in the future, and whatever your political views are aside, it's the thing that resonated with one of the things that I heard at some point early on when that movement was happening was patients want to see individuals like themselves providing care. And that resonated with me because it's like, yes, I don't necessarily think that you need to be cared for by someone that looks like you, but I think when you look around in nursing, in medicine, in healthcare, you want to see people that look like you providing care to patients, right? Like there needs to
Absolutely.
be this sense of community, and I think that's the biggest part. Um, as nurses, I think we kind of understood that a
Mhm.
little bit more intrinsically with going through nursing school, but I think healthcare broadly needed a little bit more of that. So I think it's just so incredible the steps we've taken to kind of make the landscape look different. And I was looking at something right before we jumped on this call. There was a big movement in the CRNA community because it was rather homogeneous in terms of who entered CRNA practice. There's really been a significant movement to bring more individuals in outside of the Caucasian
Right.
female persona. More males, more individuals of diverse ethnicities and backgrounds, languages that they speak. That can only be a positive aspect. And I think, change is good, right? So it's
Absolutely.
when you talk about APRNs making policy decisions, I think, again, those stories, those perspectives, and bringing that diverse opinions, really, it's not diversity in like our characteristics, it's diversity of opinions.
Agree. Agree.
So,
I think the more diverse, Chris, I just wanted to add that
yeah.
diversity, we always hear diversity is a strength. Our patients are diverse. So why
Hmm.
not the APRNs, diverse APRNs, getting a platform and while they're taking care of the diverse population. So you summed it really well, Chris. Thank you for bringing out that point.
Of course. Um, More directly, just also digging into what do you think the benefit for healthcare systems is as APRNs step into leadership roles? We've seen a lot of, I think, healthcare systems really start embracing more advanced practice provider leadership. It was really before just like physician and nurse leaders.
Yes.
Now we're seeing more APP leaders. What's the benefit that you see with APRNs being in that leadership capacity?
Again, very important question because now we see more and more APRNs and other APPs in the work settings, not only in clinic setting, but now the hospitalist. My 50% of my hospital has APRNs taking care of the patient day and night is in hospitalist, and I myself working as an hospitalist. I do see a big focus of these APRN leaders who are focusing on quality of care. They are focusing on more access to care for the patients. And they are not only focusing on quality care or access, they're actually measuring the best outcomes because when they provide the care to the patients, they do see the outcomes right there and then. Of course, there's a collaboration with our MDs and other, you know, referral bodies and other clinicians around us who are very, very highly skilled people in their own niche
Hmm.
areas. But then the way they are respecting APRNs with their decision making and their collabs, I mean, it shows that they trust APRNs. They know exactly what
Hmm.
APRNs are doing, how much focused and caring they are. So that changes the whole scenario from now to a 15 years ago, right? Because they are
Hmm.
giving us the chance to take the leadership roles. And we are not only doing this, we are so much trained, we are critical thinkers, and we bring the same continuum of care across the board in front of and filling out all the gaps and inefficiencies. So they know that where we are coming from, how our education is
Hmm.
impacting us as an APRN. So Just to summarize it, when APRNs are in leadership role, you will often see that there is an improved patient care, patient access is more because now we have fast tracks where APRNs can see the patients in the ER fast, prescribe, divert their cares or navigate their diagnosis and help them get access to the care faster than before. Outcomes are better, coordinations are getting better, and then a stronger team is emerging. If you look at in the hospital setting, in the OR setting, in the ER setting, it works like the model is really helping APRNs. So it's not just good for APRNs, it's actually good for all the entire healthcare system and for patients as well. So they're looking at the results.
I agree with that 100%. I mean, economic um, variables aside, I actually had this conversation on Sunday when I was working clinically in the OR, and it was, although I am 100% unabashedly for full practice authority and practicing to the top of one's license, I think that many other providers and legislators and the public can often be um, confused about that because I think what is lost in translation when you're trying to achieve those wins, people tend to look at them as changing practice. It does change practice, but it changes it from a regulatory economic standpoint. And I think the misnomer is that people will stop practicing in teams. That is 100% false, right? I'm very confident and comfortable finding another provider, regardless of the discipline type, that has a greater subject matter expertise when something exceeds my capability. I also am happy to be engaged as an individual practitioner when someone needs help and thinks that I have the ability to offer something to the scenario or the situation. So I think that team-based care is kind of a little bit wires crossed with full practice authority. We all practice in teams:
Yes,
nursing,
yes.
physicians, APPs, physical therapists, pharmacists. So I think that, when full practice authority and those initiatives are stalled or sidelined or impeded, it's because individuals are worried about a threat to some
Mhm.
other capacity. And so it's bringing the conversation back to the team and how can we
Yes.
best configure team models. And I appreciate that you said that.
No, I want to add one thing that when I applied for a full practice authority, even my collaborator, MD, said, "What is it all about? Why do you need this?" And it's when I explained it to him, he got it, and then the
Hmm.
manager got it, and they all got it, and they said, "Of course, this is for our benefit too." So,
Yeah.
so when you explain them, they take you very well, and they know how important it is for every APRN living in Illinois or practicing in Illinois to have a
Hmm.
full practice authority to see what benefits it gives us, not only us, to the organizations and to our patients. And the collaboration never goes away, as you mentioned. So, yeah,
Hmm.
thank you for bringing this important point.
Well, you're inevitably going to be sitting there charting next to people of different disciplines. And when you have an issue, you want to kind of ask their expertise and get their input.
Absolutely.
There's only so much that open evidence and those AI tools can do for us now. I mean, I think they are wonderful, but there's something about dialoguing with another provider who's been through a scenario, who may have seen symptom symptom constellations either that you have or they've seen them more frequently. But it's just a resource that really, to talk to another human being and a provider to go through that lived experience, I think it really is
Absolutely.
irreplaceable.
Absolutely.
Um, you've talked about this, but I think maybe you'll refine and hone in on core elements here. But what type of leadership opportunities are available to APRNs who want to expand their influence? How would you tell people this is the way to go? Like, what would you tell them to do?
In one line, I would say sky is the limit
No, good.
because
I agree.
Yeah, I mean, there's so many boards, there are regions,
Hmm.
committees. We have conference. we constantly need people to volunteer. We constantly need presenters. We need advisory committee. We need all sorts of people to help us build ourselves, because it's not for you and me only, it's for our institution. And in order to make it, there's so many avenues, and I would say tap into everything. I know, like, you are going to all the meetings whatever listed in our boards, right? You make sure that you are at the region meetings, you make sure that you are at the board meetings, and you are at the advisory meeting. So I try my best to enlist myself into each and every board, and I'm enjoying it. Not because I want to do it, because once you get into this, you want to know all the perspective around you. Because having
Hmm.
one committee, yes, you get to know this, but then you need to step up and then go. So sky is the limit, I would say. There's so many membership available. If even if you don't even want to go to many membership, just start with one. Join the region meetings and learn what's going on. Learn about upcoming events, which we are doing it. Our website is full of information, and we are
Hmm.
updating it again and again. And you know how much time and energy and people effort goes into it. Love it.
Hmm.
I mean, I started as a student nurse, and now I'm a region chair, and I'm looking onto other roles. So, I mean, I'm an example for others to see how many baby steps can turn into a giant leap for me, myself, and I. And people ask me, they look at me as a leader and they ask me questions. So I feel very proud of myself, and that I'm part of the advocacy group. I'm part of the advisory group. I'm already on the admission committees. So sky's the limit again. And then now I'm learning a lot about policy and legislative efforts, and going to the our the advocacy summit at Springfield was really, really important to learn and be one on one with our legislatures. I'm learning every day a lot in all these committees and boards. So I'm enjoying it. I take out my time to go to them and learn from each other. Yeah, it's very important.
Yep. And you know, I said this when April was the president and I was on for one of the episodes. It's like I look at leadership for those that have skied or know anything about skiing. There's like the bunny slope is where you start, and then there's
Yes,
the rope toe. And I see the rope toe as being kind of the metaphor for getting people involved. It's like, you just got to get them to hold on to the rope, and then they'll get to the top of the mountain eventually. And they may fall a couple of times on the way down, but you kind of run, you coach them, and then you get them back on, right? It's this repetitious rewriting and experiential learning that works well for this. I think there's very few truly catastrophic
yes.
decisions
No,
or actions one takes in these realms, but it's so hard to get like that first involvement. And I think to your point,
yes,
you know, activating students early is powerful. And if we can't activate students early, it's early practitioners to say, look, you're talking about why does this system not work? Well, you got to be the change, right? Be the change to see the change in the environment. And so we're obviously very aligned on all of this.
yes.
Um, Yeah, so I know that before we jumped on this, you were a little hesitant with some of the public speaking, but you're just a natural. It just flows because what I see and what I think everyone listening is going to see is a passion, right? So how does the public speaking testimony, how does this type of venue really charge you up, one, and what do you think it does for others?
Um, yeah, I've been vocal about the advocating nurse's role. I'm a big patient advocate. That's how I started as a nurse. So I was serving in my unit committee. I was in an ethics committee, but like very like slightly, because I was trying to balance work life. I had young kids.
Mm-hmm.
I was going to the town hall meetings in the hospital organized. So you start baby step. Of course, I was not vocal inside the hospital because you have to respect the environment, and you need to find your voice, right? So people are listening to you, but then again, you need to be cautious. But then I have found that I am good. I like researching. and presenting it. As you have noticed that I do go to ANP conferences, I go to ISAPN conferences, and I talk about different topics. I am big on chronic disease management, and I do a little bit research here and there. So that pushed me a lot. And then I found out that, as you mentioned, that I can talk. So I found my inner voice there, and I started talking. And then when April was mentoring me, she said, "Rosina, you have a voice. You don't need other people." But then again, I was doubting myself. But then I must say that ISAPN has just took that person out of me and put me on that platform. Like today, I am recording this podcast with you. I could never imagine doing it. I am scared of cameras because I didn't grow up with cameras. But then
Yeah.
again, I was familiarized with all these AI and technology, which helped me. And then I will talk on different topics. So public speaking is a big part which you as a president, I as a member need to take it, and we need to take it as in our advantage. Because when we talk, when we tell our stories, when we talk about our patient care, people are listening to us. So,
Hmm.
and then you become a public speaker and a leader. When they're listening to you, they are hearing your presentation. And when you are doing your providing the CMEs through
Hmm.
ISAPN, so it's a
Hmm.
it's a big deal. People are listening to you and your recordings, and they're learning from you. So you're not only a leader, you're a teacher, you're an
Hmm.
educationist. You're part of it. Whatever ISAPN is describing as a holistic picture of APRN. And this APRN is not only family nurse practitioners, it's our nurse anesthetist, it's our nurse midwives, our nurse clinicians. It's a big group of clinicians who are very learned people who are learning from each other, and not only learning, but they are giving the platform to others like me to come and talk and be part of it. So there are a lot of aspect of it. In talking to legislature, they teach you, they coach you how to talk to
Hmm.
them. I mean, it's of course we have to follow the steps and we have to follow the rules, but it tells you how.
Hmm.
So you're not only doing it in your state level, when you are going to the national level, to as I am the member of ANP, and I'm always advocating and being their voice as an ANP member. So that's how I learned my public speaking, and I brushed it off and bring it. I'm sitting in front of you today.
Well, we talked briefly before we started this,
Yes, I was
recording.
nervous.
And well, it's also I shared with you my personal preference is not to be the front man, and that you said, well, how do certain aspects of that get more comfortable with time? It's like you just do it, right?
Yeah,
And I think conversational style things, one thing I've learned about myself, everyone's different, right? Some people want notes, some people bring note cards, some people have an outline, some people rehearse. I've never found benefit with those. I usually kind of get out there and just maybe I have a few bullet points. But if I'm too heavily scripted, I start stumbling over my words and it feels very
agree.
awkward and clunky for me. Um, but everyone gets a style. And so I think your style is phenomenal. And I think, hopefully there are people out there that are listening to this that see themselves, see something they want to become in you as an example, and will get the opportunity to engage with you both as a board member and as a continued leader and practitioner in the state of Illinois. So,
Thank you, Chris.
of course, I wouldn't say it if it wasn't true. So I just want to give a little airtime and thank you for taking the time to do this. Can you just give our listeners a sense of some of the legislative issues that APRNs need to be paying attention to right now? We had our recent legislative, drop in or fly in at the Capitol down in Springfield, but what are the core things that you want key issues people to be aware of right now for us?
Another very important question, and people ask us all the time, right, Chris?
Hmm.
What are we doing? Why are we going to Springfield? What is our agenda behind it? And our agenda is one and only. The key issue is we need to describe ourselves. We need to talk about scope of practice and its protection, because we want to keep this APRN institution and our voices alive. reducing a lot of administrative barriers, which takes a lot of time, energy from us, and it takes away from patient care. And then improving the access to care for each and every one of you, whoever comes through our door or whoever comes through our our mind or our daily practices. We want to make sure that we improve this access, and somebody's listening, and while making the policies, we are right there and then to give them the guidance, to provide the feedback, take the feedback, and shape it well so we can apply it in every practice of our life. So I think these are the key issues for me, and these aren't the only one. And we cannot win it by ourselves. They require ongoing advocacy and talking and dialogues with our legislature so we can continue to protect those. So I feel like these are very, very important key issues.
100%. Relationships with all individuals, whether internal to ISAPN, legislators, public members, keeping people informed. So, but relationships, right? Like we need to form relationships with people. And I actually went and met with my legislators when we were down there. And
Yeah.
I said, I don't want anything. I actually don't want anything.
Just
I didn't
hear
go
me
through the
out.
script because I've learned that the script is just kind of it just feels clunky. It's like me getting up on stage with a bunch of notes.
I agree.
Um, and I said, look, I just want to meet you. I just bought a house in your district. I put down roots and shared kind of the personal story. And that was so much more comfortable. And I said, if down the road there's something that comes up that I could engage you on, would that be okay? And of course, the answer is yes, right? But it was nice to meet as
Yes.
people, not as this transactional thing. I heard you say that. Like, try to build the relationship, try to do the storytelling, and avoid just, hi, I'm so and so, here's a business card, these are my issues, right? Because they get that all day long.
Yes.
Um, Another theme that I just want to share that kind of like spurred up in my mind as you were talking, and not to steal the show because that's not my angle. Um, I think too often we look for and expect to take a giant bite of the apple and eat it all in one bite. So much of the legislative lawmaking work is incremental wins that
Yes.
that total up to being an achievement. And I think NP Full Practice Authority in Illinois was a good example of that, how that came to be. Getting nurse midwifery colleagues some of those same rights in majority of the state with some carve outs. We had to make some concessions, and hopefully the next being the CRNAs. But those being examples, not meaning to like focus on the issues, but to talk about it doesn't just happen overnight, right? And so you and I will be here for a time period, but we need to be mentoring and training the next group of people to take our places as we kind of move back and allow them the opportunity. So. Um, We do have a CE community engagement event coming up. Do you want to tell individuals listening about that? I know it's this week, so they're probably going to get this in short order, but do you want to just give them a sense of what event we have coming up this week?
Yes. So next, I think this weekend, Friday to Saturday, we have our upcoming pharmacology updates coming, and it's a great event. I attended last time. I earned almost 20, how many? 32 CMEs, tons of CMEs, all related to pharmacology. We have great speakers lined up. Um, this is one place when any APRN excuse me, can go and get their. This is one place when our APRNs can go and get their CME hours done at
Hmm.
one under the one roof and meet all our leaders, our representatives,
Hmm.
our our committee members, and then talk about it because we do have a meeting on that day, board meeting, a day before. So they all will be there. They will be available for them, not only to help them understand what ISAPN do, but then providing a biggest opportunity of having a CME right around the corner. Is it in an Urbana Champaign?
It is.
Yeah,
And it's actually just Friday, the
it's
17th.
Friday
But
only.
Yeah,
It's a
yeah,
whole
it
day.
has been.
And then that's where they come, and they one day they can drive down there. It's an easy drive. They can go there and relax and learn our
Mhm.
and get their CMEs while they're coming back home, and meet with our wonderful leaders who can provide more information for upcoming event. I think it's a most popular event of ours, and a lot of our APRNs come together, learn about different diseases, not only diseases, are new guidelines, new,
Topics.
um, uh, um, updated information so they can apply back to their,
Hmm.
and it keeps them going because it's happening every year. So I would urge all my APRNs who are listening to me to please join us this Friday. We start early in the morning. If you are there 8 o'clock, we can feed you a good breakfast. Be there and be part of this a great continuing education and a summit where you will learn and meet so many people and be with your I think your hands and your brain will be filled with a lot of new information. And it's a great opportunity to meet our leaders as well.
100%. Couldn't have said it better. Um, and we're looking forward to meeting all the
Absolutely.
individuals, all the members and non-members. If you choose to come, you're definitely welcome to come if you're not a member of ISAPN. And hopefully we'll convince you to join. But if even if we don't, it's still great to meet colleagues across the state, regardless, because we're all kind of facing the same challenges. And we do represent all APRNs. We don't just represent members, we represent all APRNs, and we
Absolutely.
really seek to be the voice and the thought leader when it comes to the issues that are contemporary. So I know we're kind of getting close to the end of our time here. And you had shared that you want to provide a little bit of advice for those that want to get involved. And some of it you probably have said, but what are the take home messages if someone just fast forwards through our conversation because they have ADHD or they're like me and they put it on 2 times speed because that's how they focus. What do you want them to hear at the end? Your kind of soundbite, your take home message given our conversation today.
Those who are listening to me, my biggest takeaway message is join us. Join ISAPN today. If you are joined but you have not renewed your membership, go ahead to the website and go to the Illinois Society for Advanced Practice Nursing. It's a simple website, as you can see on the logo as well. Please go check out our website, sign in again, renew it. For students, we have extra discount available. Please avail that. It's the very minimal, um, you know, charge where we provide tons of information, CMEs, opportunities for the students to join us, and not only for the students, for our APRNs as well. Participate in advocacy initiatives. Listen to us. Come join us at the Hill. Be part of us. Be
Hmm.
our one voice. Attend all the educational events. Are you unable to drive all the way there? Go to the online. We have lots of mandatory CMEs available,
Hmm.
and they are free. The best part is they are free. So please avail that opportunity. Attend those educational events on your own time, on your own ease, while even you are vacationing. So we are never leaving you alone when you need to be alone. We are always around you as an ISAPN. And then explore some of the leadership opportunities which are available and listed. Look at the profile of Dr. Chris. Look at the profile of other regional members and see what how similar you are and how you can be participating and providing your valuable knowledge to us so we all emerge as a great institution, as a great um, voice, so we can extend ourselves, we can be part of this great institution and voice it when we need to voice it. So that's all I have for me today.
I love it. I love it. Rosina, I can't thank you enough for being here. I can't thank you enough for being part of the board because I know what a lift that is. It's a volunteer activity, takes time away from your family, other things that you'd rather be doing. But your commitment to the organization, your commitment to our collective APRN community is really, it shines through just listening to you talk. So I want to thank you for that. I want to thank the listeners who keep putting up with the podcast. No, I'm just kidding. I'm so glad that you're joining and you're finding value in this. And I'll keep doing it, and we will keep doing it as an organization because I think that the dialogue is helpful. And we'll see you next time on Inside ISAPN.
Thank you, Chris, for having me.
Thank you.